So I want to talk just a little bit about the adoption of technologies among mental health practices. Of course, we use the rudimentary technology of pens and notepads, but also starting in about the year 2000, practice management software became a thing, Galaxy, Callplus, Clinicos, and here is the adoption curve. The adoption curve is, in 2000, close to 0% of people were using it, and then it went up to 50%, and they'd hope that most people are on it. And then another digital adoption curve would be digital assessments, which were popularized in about 2010. And in 2012, we released the first version of NovoPsych. And then telehealth. So telehealth, you remember Skype? Skype was invented in probably 2005 or probably earlier, in fact. But in actual clinical practice, it just wasn't used until something happened in 2020, COVID, and then everyone got on it really quick. Probably the biggest, fastest adoption curve ever. So sometimes, even though the technology is ready, it was probably ready for years before COVID, it took a catalyst. And then another sort of technology, and I use the word technology broadly. Technology is the application of science. And so I count EMDR and particular methods as in some ways technology. And I think that that's really growing like really quickly at the moment, even though it had been around for ages. The black line here, I think, is AI. AI, ChatGPT has been around for a few years now, but in clinical practice, really 2024 and 2025, and we're seeing this adoption curve. And I believe that by the end of 2025, most clinicians will be using technology.